are these people?
So a little update, regarding Medicare for All. So for those of you who know or may not be aware, so the Marches for Medicare for All started last year. What was initially going to be just concentrated in DC ended up being, I want to say, it happened in over 50 towns slash cities across the United States where people like from different states marched in the name of for Medicare for All. So they had, their second march in only in DC this year over the weekend. So our friend, colleague to INN, Elias Sepia, who is a writer,
Yeah.
was asked to make a video that they shared at the mart. So we wanted to give him some love and play a little bit with you, and then just show you guys a brief snippet of the marches in DC and what was happening there. So let's see if this works.
I might have to play.
Yeah.
Thank you for allowing me to give my brief address in absentia during this grand week of in-person gathering and work. I'm always amazed by the sacrifice in pursuit of a better future brave comrades like you all make with your activism. I am also struck by the modesty of the request and the patience and good faith with which it is being made. I speak now to any and all national elected officials who are witnessing our demonstrations this week and considering your demand. These people who have convened in Washington this week are politely making a reasonable and moderate demand: Medicare for all. Contrary to how its opponents in both major American parties characterize it, Medicare for all is not so bold and compassionate an idea as to qualify as socialism. That is to say, Medicare for all is merely a type of publicly funded health insurance program that would leave a great deal of our failing privatized patchwork of a system in place. In a less barbarously managed nation, there would be more hope that we could simply move straight into the realm of the civilized, jettison health insurance of all types, and demand a true national health system, where all residents of this, the richest country in the history of the world, could avoid middlemen and have direct healthcare access 24/7, every day of every year. Still, these moderate, patient people congregating in our capital realize that given the dire situation we're in, any sweeping reform that results in improved health outcomes is worth working for. And to be certain, the situation is desperate, especially for people of color, and Medicare for All would help us. 30 million people currently don't have health insurance at all in America, and tens of millions more have health insurance so meager that they can't even afford to actually get medical care when they need it. As it stands, millions of people who do have health care of some sort have it tied to their employment. And at a time where workers are experiencing diminishing purchasing power and job security, that type of arrangement is particularly cruel. All of the truly existential problems caused by being uninsured or underinsured are felt disproportionately by people of color, including Latin people. People of color account for over half of the non-elderly uninsured population in the U.S., despite being just over 40% of the overall population. Both Latin and Black people are uninsured at much higher rates than white people, and Latin people are the single most uninsured population in the country. Right now, in America, millions of undocumented Americans who make the country better by simply being in it, and many of whom make it run by growing, picking, and cooking and serving our food, tending to our stores, caring for our children, and countless other essential jobs, and who all pay higher amounts of taxes per capita than the general population does, who also have lower rates of criminality than the general population, do all this without basic protections and benefits that they've earned, including health care.
So thank you, Elias, for sharing that. I mean, that's not the whole thing. If you want to, we should probably share his Twitter
I got it.
In the chat. So like if you want to follow him on Twitter, you can. Or if you want to watch the rest of it, it's about 9 minutes long.
In the
I think it's
chat.
also available on YouTube. So cool. Thank you, Reef. And so let's go to the next slide.
Yep, I got you.
People die! People die! People
Hey, I know those ladies.
die! What do we want? Medicare for all! When do we want it? Now! Insurers deny? People die! Insurers deny? People die! Hey, Humana, what do you say?
Today.
Hey, Humana, what do you say? How many people have you killed today? Liar, privatizer! Liar, liar, privatizer! Liar, liar, privatizer! Liar, liar, privatizer! Medicare for all! Now! Justice for all! Everybody out! Nobody out! Nobody out! Hey, Blue Cross, what do you say? How many people have you killed today? Hey, Anthem, what do you say? How many people have you killed today? Hey, Humana, what do you say? How many people have you killed today? What do we want? Medicare for all. When do we want it? Now.
We have 3 non-negotiable demands. Healthcare. Healthcare is a human right. Healthcare is a human right.
Yeah.
Let me know if I'm going to run into anything. Healthcare is a human right. Healthcare must be free from corporate profit. And finally, healthcare can only be achieved through national legislation. Medicare for all. Thank you.
You want to talk about your side?
Yes. My representative is Nancy Pelosi. She's the Speaker of the House, and she's the person that is preventing Medicare for All bill, HR 1987, from being voted on in the House. So I hold her personally responsible for not bringing Medicare for All to a vote.
And what is your critique to people who say, you hold her personally responsible, we should spend more energy talking about the Republicans? What is your critique to them?
No, Republicans need health care too. Everybody supports Medicare for All. Republicans, Democrats, it's a nonpartisan issue. This is not about the Republicans. This is not about the Democrats. This is about the demand that people have for Medicare for All.
Love it. Shout out to all the organizers for the March for Medicare for All. You know, it sounds like it was a great time over the weekend. Unfortunately, I wasn't able to go, but it sounded like, it seems like, of course, you know, it's been hard to topple what happened last year, but considering the circumstances, it sounds like it was a great time on Saturday for those of you who attended. I'm sure it's going to happen again next summer. So mark your calendars for like late July 2023. I'm sure there's going to be another one in DC next year. So anyway, I mean, our audience, I'm sure, you know, you guys know this, you know, Medicare for All saves money. You guys don't need to be told this, but there's just more proof, you know, from organizations in California that are saying that most people, if in California, if they were to have Medicare for All, will actually save money. So once again, this article is by Brett Wilkins. Working together, Californians can save our state billions, save each family thousands, and most importantly, guarantee health care for all so that everyone has equal access to life-saving treatment.
You got it? Or you want me to?
Hold on.
Yeah.
Okay, got it. Universal healthcare campaigners in California on Monday unveiled a tool that shows how most working families would save at least hundreds and likely thousands of dollars each year if the state implements a Medicare for All type system. The advocacy group Healthy California Now, together with National Union of Healthcare Workers and University of California, San Francisco professor and health finance expert James G. Kahn, launched a calculator that compares what individuals or families currently spend with what their costs would be under the type of Medicare for All system that Democratic Governor Gavin Newsom campaigned on a promise to enact, but has done nothing to advance. It's a new day for healthcare reform in California, and working together, Californians can save our state billions, save each family thousands, and most importantly, guarantee healthcare for all so that everyone has equal access to life-saving treatment. Healthy California Now President Michael Lighty said in a statement, "Every second of inaction costs hundreds of dollars, and each year of inaction has an even greater cost, 4,000 lives." According to the calculator, a family earning California's median annual household income of $78,600 and paying $500 in monthly health insurance premiums and $4,000 in yearly out-of-pocket costs, whose employer contributes $1,400 per month towards healthcare costs, would save nearly $16,500 every year under a Medicare for All system. An individual making $50,000 a year with a $300 monthly health insurance bill, a $500 employer pay-in, and $1,500 in self-funded healthcare expenditures would save $7,600 annually. So this is their tweet. The moment we've all been waiting for is here. We are so excited to launch a project that our team has been working on, our healthcare savings calculator. We want you to be the first to try it, share it, and tell us what you'll save. So that's a link to the calculator there if you're interested. For an uninsured person or family earning under $50,000 with less than $2,500 in out-of-pocket healthcare spending, savings would range from hundreds to around $2,000 per year. Taxpayers already foot the bill for over 70% of our state's healthcare, Kahn said in a statement. The savings we can achieve by cutting the waits in private health insurance will allow us to guarantee improved healthcare services for all Californians while also lowering costs. Our estimates of spending under a universal healthcare system account for the added taxes required to cover that single-payer budget, while premiums and out-of-pocket costs disappear, he added. Overall spending for single-payer will be less than under the current system, and taxes will be higher only for the very high-income earners and corporations. Thus, the vast majority of working families will save money. Although he campaigned on the pledge to deliver single-payer healthcare, Newsom has disappointed activists by backing away from his promise and taking hundreds of thousands of dollars in campaign contributions for the private health insurance industry. In January, AB 1400, a bill that would have implemented a single-payer healthcare system in California, was withdrawn from consideration in the state assembly in an 11th-hour move that shocked and outraged progressives who have fought for the measure. While Newsom has expressed concerns over the cost of universal care, the governor's Healthy California for All Commission reported in April that such a system would save 4,000 lives annually and $500 billion over the next decade. $500 billion over the next decade, sorry. Meanwhile, the commission found that healthcare costs are projected to rise 30% over the next 10 years under the current system. The door to quality, universal, and affordable healthcare is open, he wrote. On the other side is a California where we save lives and save money by cutting out waste and bureaucracy and putting quality healthcare before private insurance company profits. A 2020 study published in the medical journal Lancet found that Medicare for All on a national scale would save Americans $450 billion and prevent 68,000 unnecessary deaths each and every year. Last month, Current Dreams reported that a universal single healthcare payer system such as Medicare for All could have prevented over 338,000 US COVID-19 deaths.
Yeah.
Yeah. So, like I said, this is not new to most of, not all of us here, but just giving more proof that we need to have Medicare for All.
Nice.
Any thoughts, Reef?
That we're doing well on time. But other than that, like, yeah, I mean, I feel like I don't trust California necessarily to do great, like, healthcare either, especially if it's state funded. But, like, it obviously would, you know, I feel like it's it's one of those things where it's like it just shows off how terrible the state really is, because if they actually were trying to do something, you know, like you would think that if you wanted to actually work out a pandemic, something where people could afford healthcare would be a good idea, you know,
Right.
and like didn't have to pay for healthcare, like
Right.
would probably be smart. But
Which we could under a public health emergency, which I'm sure COVID-19 will fall under that. You
which
can maybe also count this monkeypox, whatever this
whatever that
is, you know, I'm sure it probably won't get to national public emergency, I'm sure, but you know, you can almost kind of point that as well,
right.
as a public health emergency. If I think Biden had the balls to do that, but of course he won't, because he's tied to corporate interests and the private health insurance agency, that he's not going to do that. So,
Yeah.
but again, like I said, this is nothing new to you guys. We know that Medicare for All, well, personally, I'm for nationalizing healthcare, because Medicare for All is basically the compromise still, because it still involves private health insurance companies, you know, like, and I know there's going to be a lot of mistrust as far as the government, you know, handling, you know, like healthcare. But that would be the most ideal to ensure that people are getting the healthcare that we need, you know, without having to worry about all these extra fees and costs that are associated with that.
I agree. But yeah, that's our show for this evening, everybody.